Let's talk about de-roofing procedures. The prime candidates for de-roofing procedures, and when you want to consider these procedures, are when you have a recurrent boil-like abscess that continually drains fills in the same spot over and over and does not relent. That is a great candidate for a de-roofing procedure. Another great candidate for a de-roofing procedure is if you know that there is tunneling happening between two abscesses. That is another great option for a de-roofing procedure. These procedures are on the smaller end. They are better than incision and drainage or INDs. We do not recommend INDs. And the reason is because when an IND is done, they basically make a slit with a scalpel and then push everything out that they can get out of the abscess, and then they go ahead and just let the flaps close over the top, which means that it closes very, very quickly and will then usually recur and fill up again. There is nearly a 100% recurrence rate when it comes to incision and drainage. This is why we recommend de-roofing procedures instead. With a de-roofing procedure, the difference between that and an incision and drainage is the physician will go in and they will again make an opening, whether that's with a punch biopsy tool like they use for skin cancer or something like that. It makes a perfect circle. Or they will go in with a scalpel, open up the lesion, and then they will from there take out everything that's inside, which is biofilm usually, and that is what keeps our wounds from healing. Consider it like a double-sided sticky tape on the inside of a wound. So they go in and scrape all of that gelatinous material out of there, and then they cut the top off of it so that it is almost like a valley, or if it's a single abscess, usually it looks like a valley if there is a tunnel in there. Or for a single abscess, it may look like a hole that may look bigger than you would have anticipated because they went in there and scraped all of that out, so that then it heals from the bottom up. That healing means that the recurrence rate is so much less. It's an amazing procedure. The healing time is not that long. Wound care is very simple for that procedure. It's basically Vaseline and some gauze or bandaging. It's something that you should definitely consider if you are plagued with an abscess that keeps coming back over and over. The one side note I would make, even though you have what may look like a single abscess on the outside, it may be starting a tunnel somewhere. So when the physician goes in and opens up that tunnel or the abscess, in addition to scraping that out, they're also feeling around the edge of that with a blunt probe or their scissors tip to see if they feel anything that feels soft, like it could be the beginning of tunneling. So you may go in for one small abscess the size of a dime, and what they find may be that abscess was starting to tunnel elsewhere. So they will follow that track, that tunnel, and cut that open so that you have less of a reoccurrence rate. So it is one thing to make sure that you are aware going into the procedure that what you think you may be going in for may end up being slightly bigger, but that is not a bad thing. It means that that physician is doing what they need to do to follow whatever they have found. So just make sure that you're aware of that as you go in. It's not always what it appears on the outside is what they can see on the inside is often different. So if there are any questions about this, please ask. We would be happy to address them. We know that there are tons of questions and we're going to provide as many resources as we can.